Good morning, everyone. I hope you're enjoying the conference so far. My name is Alan Wareham, and I'm the moderator for this session. I want to thank you all for coming to session 9B, which is titled Sharing Deafblind Knowledge and Practice with Service Providers and Families Through Online Learning, a pilot program in Ireland. I'd like to introduce the speakers today. We have two of them. Deirdre Leach is a deafblind consultant for the Anne Sullivan Foundation's outreach services in Ireland for the past 12 years, working with infants, children, and adults who are deafblind in a variety of settings. Prior to that, Deirdre was a teacher of deafblind at Perkins School for the Blind for 14 years after getting her Master's of Education degree at Boston College's Low Incidence Disabilities and Deafblindness program. Deirdre is involved in DBI through the Charge and Youth Networks and is the Communication Ambassador for Ireland. Deirdre has a passion for training awareness of deafblindness, developing communication strategies for all, and enhancing literacy materials for students who are deafblind. Today she is joined by Sorka Nallen, get that right? Who has 6 years experience working with people who are deafblind at the Anne Sullivan Centre in Dublin, Ireland, primarily with adults who are congenitally deafblind. Sorka received a postgraduate certificate in multisensory impairment from Birmingham University in 2018. In 2021, Sorka was project manager on a deafblind literacy project, which successfully created accessible books for children who are deafblind in Ireland. Sorka is currently working as a deafblind communication specialist for the Anne Sullivan Foundation's outreach services. Please join me in welcoming them.
Thank you so much. Leave that right here, actually. Hi, everyone. We're really happy to be here. My name is Deirdre Leach, as Al said. I am an average height, middle-aged, blonde woman with glasses, wearing a black top and a blazer.
And I'm Sorka. I am a woman in her 30s. I've got brown hair, and today I'm wearing patterned pants and a white top.
How do we advance that? Oh, the clicker. You're gonna do that.
Sorry. So today we're going to talk through the process of how we developed our online training program. So we're going to take you from where we started to where we are today. And Alan gave us a great introduction there, so there's no need to go into too much more detail. But I think what's probably more relevant is just to know that there's only two of us covering the whole country of Ireland. I cover the east of the country, and Deirdre covers the west. Between us, we do a lot of travelling to try and visit people who are deafblind across the country.
Yeah. We won't go any further into our backgrounds, but just really quickly before we get into our presentation is just to know that this presentation is a result of the DBI conference in Aalborg and a meeting that we had with a few of the members of Deafblind Ontario services, so Karen, I don't see them here, but Karen, Roxana, and Kelly, who we had a meeting with to try to help develop our services and the recognition. So we're going to go through that as we go through today, but really just to say that we wouldn't be here only for that meeting in the last DBI conference.
So just a little bit of context in terms of what we do. There's a couple of branches to our organisation. We're a very small residential setting. We have 13 residents, and we're at full capacity with that. And an even smaller day service, we only have 2 day service users. And our residential services are based in Dublin. Most of the residents have congenital rubella syndrome, and they are all one-to-one staffing.
And then the Anne Sullivan Foundation, which we both fall under for the outreach services, is more of the charity, and they also fund some special projects. They take care of the residential houses that the center have. And you missed your shout out, Kelly. You missed it. and fund our outreach services. So those were set up in 2010, so they're very new. And I was the only outreach person for a number of years until a few years ago they realized we needed to expand more and that I couldn't travel any more than I was. So that's when we set up or had a second person. So now Sarika is the other person that provides outreach, and we provide services to people of all ages. So whether my background is in children and adults, we both work with children, adults, infants, elderly, at any stage of life, at any level of deafblindness, in any part of the country. So it's really, really open, and we don't turn anyone away, and we take referrals from anywhere, from disability services, from parents, from schools, from visiting teachers, from lots of different places.
So just to give you a quick idea of what deafblindness is actually like in Ireland, on this slide there is an image of the outline of the map of Ireland, and within that there is the figure of 5 million, because that is the population of Ireland right now. So the biggest barrier we have is that deafblindness isn't recognised as a disability in Ireland. So as you can imagine, that makes our job very hard. We're not mandated, we're not required to go visit these services. A lot of people don't even know that we exist. So that's kind of why we needed an online course. We have signed and ratified the UNCRPD, but despite that, it's still not recognised as a distinct disability. We also obviously don't have any third-level education programs in multisensory impairment or deafblindness. So that means we have to go abroad to specialise in the area. So we go to the UK, the US, or other parts of Europe. We have no intervener role or certificate equivalent, and there's only 2.5 outreach workers, so 2 full-time and 1 part-time outreach worker. And we don't have exact figures of how many people in Ireland are actually deafblind because it's not recognised as a disability. So at best guess, it could be 1,800, but it could be much higher than that. We really just don't know. So currently, we support roughly 150 people. So you can see there's a huge gap there of people that we are missing.
So the next slide has a bar chart that shows the breakdown of our clients that we're currently serving, just to give you an idea of the age ranges. So early intervention, we have about 17, school age about 49, adults, we provide service for 52, and elderly 15. So I know from some of your countries that seems like a very small number, so it is all relative, but again, it's just the two of us providing services for these. And these numbers change, as you know, from day to day. So you have people that don't engage with your service, and then since we've gotten to Canada, we've gotten a few new referrals. So it figures. As soon as we go away, that's when people start contacting you.
So this is our timeline for how we developed our training. So the seeds were sown in 2018 when we attended the Alberg conference, and we met with the Deafblind Ontario team. And from there, we just started thinking about what exactly we wanted to include in our course, what was going to apply to as many people in as many services as possible. And then, blessing in disguise, COVID hit. So we had the time to really push the course, develop it, fine-tune it. And more people had time to dedicate to attend our course as well, which was obviously a big help. So to date, we've trained over 600 people in an introduction to deafblind specific training.
And just to go back to the advice and meeting with Deafblind Ontario, we had made contact with them before the conference. And I suppose what really frustrated us most, not only the recognition, but I suppose with recognition, that's where we would maybe have an intervener role. So we don't have that intervener role, and we know, we keep hearing in every session about this, and we're so jealous. But that was the advice, was you have to start from the bottom, and you have to start teaching people, and just start, presenting, giving training to all of these different services who are working with, I call it on the ground. So we're not direct, we might work directly in a small capacity, but the people that work every day with our clients, they're the ones that need the training, because they are there day to day and we can't be. So that was the advice, was sort of just give training, and just start building it and get people trained, and hopefully over time, and they said it may take 10 years. We're how many years later? We're no further on, but hopefully in a few years we might see it. But that's really was the advice, was just go and provide training. That's me, sorry. So how we did it, how would you do anything? You sit down and you make a list. Before you go to the food store, you make a list. So we kind of just gathered our favorite information, our favorite, you think about, the trainings that you've been to, because I'm sure everyone in this room has had some form of deafblind training, or you wouldn't be at this conference. But what did you like? What really, what got to you? What made you really understand and appreciate the needs of someone who is deafblind? And of course, I had my degree, and I had, Boston College, Barbara McClutchy, and Susan Bruce came after I left, but I still feel like everything she says is reverberating. And so we gathered all these resources and really just included our experience and anything we felt people would want to know. And we put it together in a PowerPoint. It's not brain science, but this is the process we went through in order to get this information out there. And again, because, as Sarika said, we're not mandated. Nobody's required to have us come in and work with their client. We're nearly trying to sell ourselves. And it's a free service, but we're nearly trying to sell a free service, which sounds very ironic and odd, but that's what we have to do. We have to get people to connect and understand that this is important information, that the one person that's in this disability service who is deafblind needs a different approach. So we piloted it with a small group of colleagues who we knew would be honest and give us feedback, and we started it, and I think that's around the time that we were all, again, working from home, lockdowns. So they were only delighted to sit and listen to us over Zoom. And then we began to get more confidence, and we offered it to any of the residential staff at the center who work with the adults at Anne Sullivan Center, and their families, and the multidisciplinary teams that work with our clients. And then eventually we just started sending it out and inviting outside organizations. So they may not work with anyone who's deafblind, but they may. Or they may, someday. So we just said, look, it's information that people can use, so we just started sending it out. And I think, again, the fact that it's a free course, people love that, so they come.
So on this slide, in the center of it is an animated generic image of a child with no face. I know that sounds weird. And then surrounding that are the roles or the titles kind of people that might support someone who's deafblind. So as Deirdre said, everything starts with a list, and our list just kept growing. And this isn't an extensive list. There's probably a lot more people we haven't even thought of that actually do support somebody who's deafblind.
Who's noticed what word is missing from this slide? What word that we've just mentioned? We have some in the room. Intervener. Yeah. We don't have this on the slide because we don't have interveners. We have interpreters, we have special needs assistants, we have care assistants, we have a lot of those roles. And again, it's pitched towards people in Ireland who are working in services in Ireland. So these are the people that we are training. The next slide just has a list of the modules that we created. So the first one is really an introduction, and then followed by hearing, vision, guiding, specifically for people who are deafblind. Then we have a module on awareness and accessibility, communication, which is a 2-hour module. It's the longest one, of course, as you know. And then we look at more strategies for adults, vocational daily living skills, and community participation, and then strategies for young children. So really you can see from this, we really touch on every age, every ability, every level, every kind of need in it. So people that come get a lot more than they signed up for, because they may just be working with an adult with acquired deafblindness, but they're also gaining information about working with a child with congenital. And that's one of our, we're going to talk about some of our questions, and we have questions for all of you as we go forward, how to go about that.
On this slide, there's a bar chart And on the bar chart is the breakdown of the people that completed our course, so from 2020 to 2023. So you can see course numbers were higher when people had more time. So we are noticing that now that there's less people enrolling in it. People are back in offices, back doing full-time work. So things are changing kind of more towards what they were like pre-COVID.
The next slide has an image, a drawing of the map of Ireland with every county in the country highlighted in red. And what that is showing is we've had participants join us from every county. Now again, the size of our country probably is like the state of Maine in Massachusetts, if that gives you an idea. I can't, unfortunately, connect it to a province in Canada, but I'm sure hopefully Maine is close by. People can look up Maine. So we've had people come from all over, again, online. If we were having them come to us in person, we wouldn't see this. And they come from disability organizations, educational, health service, charities, mental health services, all kinds of different organizations. We do talk fast, so we're just giving the interpreters a chance to catch up. Please tell us to slow down if we are too fast.
Okay. On this slide, there are two images. One is of a map of the world with countries highlighted where we have provided training. And above that is an image of hands around a globe.
You list them out. I'll list them out.
So we've had participants join us from all over the UK, and then as far as Peru, Russia, Singapore, and the United States. And that wasn't our intention. We didn't intend to reach people in other parts of the world, but word of mouth spreads fast, and so does social media. So I think a free course was enticing to lots of people, so that's how this materialized.
So some of the benefits that we've found, I suppose when you're a consultant and you go in and you meet someone for the first time and you make some initial recommendations on deafblind strategies that they should be using that we see would really, benefit them, help them get more access, help them develop their communication, we don't often have a chance to keep going back to that place, that setting, and explain the recommendations more, because you just don't know how much people retain in that first visit. If it's a teacher, they could be distracted because other students could be misbehaving or just, busy. And if you're in a home, there could be, other things happening in the home. If you're in a day service or a residential service, there are, again, lots of things that go with that. So we could follow up and explain what we've recommended in the past. We've also found that we've gotten new referrals from the course because people saw a wider definition. The thought was deafblindness means totally deaf, totally blind. And we've all heard this, and we go over it. So we're really dispelling that myth. And people are saying, oh, I actually have this other person in my service, and they actually fall under this umbrella term of deafblindness. So that was great. The strategies we presented, people found fairly useful for other clients in their service, that it wasn't just for people who are deafblind. I suppose there was no other course, so we really could go any which direction we wanted, and there was no one saying, well, their course is a little better than yours. We were the only one. So we had that going for us. And the result of maybe one person from an organization joining the course was they went back and spread the word and said, you've got to do this course. And they might book a training then for all of their staff, even if they weren't working with the individual who is deafblind. So that was really exciting, because that was a sort of side benefit that we hadn't planned on, but a really nice one.
On this slide, we have an image of two hands reaching out to touch each other. And we chose this image because the nature of deafblindness does involve touch, and we realized that an online course contradicts that. But we needed to develop the course in that way to reach more people and spread the word.
So the next slide has a lot of words. We're not going to go into everything, and you'll be able to look at the slides later, but just really looking at some of the pros, cons, benefits of kind of things we learned that you could do in online versus in person. So I suppose for the online, we really had to get creative when it came to simulation, because we couldn't say, this is how you do tactile sign, this is how you guide. We had to explain it and think of the words to explain it to really get people to understand. We were able to reach a lot more people by doing it online. Traveling, even in a small country, we found people just, they can't get the time off. It was complicated. And we found that when you had an online course, people were much more likely to join. People who joined the course from different organizations were able to meet each other, who would never have met before. And that was really interesting. It's kind of like, this conference, unless we came here, we wouldn't meet each other. And they were able to interact and maybe collaborate by sharing examples or whatever. And again, like the travel time was reduced. Sorry, I did read all mine. I wasn't going to.
There was a couple of issues with doing online learning. Sometimes nobody would turn their camera on, so it felt like we were just talking to each other, and there could be 20 participants. So that was difficult.
We've all been there.
Obviously, as Deirdre mentioned, lack of interaction. Because we're online, people aren't naturally talking about things, bringing up things. You don't get natural feedback. You're not seeing people nodding along or shaking their heads. And again, you don't have physical examples of things either.
This is what a tactile symbol is. This is whatever. And same with the previous one. Like, we're getting energy off all of you right now that you wouldn't get when you're online. It's very it's very blank. So it was hard, but you kind of just push through because you know it's a good thing. Some of the teaching tools that we found really handy, and these, again, we didn't invent these exist. You probably all use these, but the way in which we use them and kind of how we worked them in, I feel was really helpful. So Mentimeter, it's just a free online tool. You can do polls and ask questions. So we could really, from the very first session, first few minutes of the session, we could find out who worked with adults versus kids, or both, what age group, what area they're in, what concerns they might have, their experience. Are they new to deafblindness? Had they lots of experience? So we could kind of gauge where we went with the examples. Obviously, the chat feature was really good. If we asked a question, what do you think this symbol means? And everyone could kind of type it once. Whereas if we had asked all of you that question, we'd have to go around, and it would take a long time. So we could get a really quick answer on the chat feature and get a really good kind of summary in our own heads of where people were understanding or not understanding what we were trying to teach. Again, the simulations, since we couldn't work on a touch simulation with people, we really had to get creative and give them sort of guided simulations and homework. We gave them homework. And, after the guiding session, we said to them, try and walk a very familiar route within your home or your office, blindfolded. And I said, have someone with you for safety and just see, what you feel, what you understand, where you think you are. And then we have them do it again with earplugs, so that they can realize how much of the sound awareness that they use to locate, and things like that. But until they did that, they really don't put themselves, in the place of the person that they're working with. And they always come back and say, oh, that was such a good activity. So we couldn't do those with them, but we could sort of give them some guided simulations. And then we really believe in a multimedia. Now, we have no videos today for you because we're trying to keep it tight. But in the course, we show a snippet from the short movie Feeling Through, which hopefully everyone in this room has seen. Please tell me, please tell me. If you haven't, you're going to before this day is out. It's only 17 minutes, 18 minutes. And we show a 2 or 3 minute clip which really shows what it's like, the vulnerability and tactile communication. There's loads of parts in just this one little section we do. Deafblind Ontario's communication video is fantastic. It's 2 minutes long and it shows 3 different methods of communication. We show that. Nice video on protactile, which really opens people's eyes up to, social haptics and tactile communication. And, anything else we have, if we have videos of children we're working with that are using an active learning space, people love to see that because they don't get it. It's a box. What do you mean? What do they do? We show them a video of a child interacting. Which?
Feeling Through.
Is it on YouTube? If you Google Feeling Through, you'll get to the website for the movie. The main actor is deafblind, and it was up for Oscar Awards in 2019, 20? The years are flowing together. So we can give you that after if you'd like.
So there were some challenges, some we've touched on already, but because there's only 2 of us, we had to manage the registration, communicating with everybody what dates the course was on, sending reminders, and that's on top of doing visits, implementing things. So that was difficult. Time management was a big part of it as well. Another big issue is within the services, the diversity of the clients and their needs. So our course really had to be something that was accessible for everybody, that somebody would get something out of each course. And then keeping the content updated and accessible. Things are always changing in the deafblind world. There's always new technology, new ways of doing things, and even new ways of communicating. So, it is difficult at times to keep on top of it. Again, because there's only 2 of us. It has happened that in courses, people have told us about these new things that we haven't heard of. So that can be hard.
And we adapt. The next slide talks about the feedback. And every course we would send out an evaluation and get feedback. And we really would take it on board. And at one stage, and I think this was sort of coming out of 2021. It was 2022 because I have it here. In September last year, they said the volume of information was quite large. It may help to condense it into a shorter course. And we thought, you know what? If that allows more people to come, let's do that. So we moved some things around. We took out the awareness and accessibility course, and we've sort of given that to our advocacy person to maybe do that with like public services, hospitals, hospitals, transportation, things like that, and kept this for direct service providers, so what they need, the strategies that they need. And we just sort of condensed it down a bit from a 6-hour course to 3 1.5-hour sessions. So from 6 hours to 4.5 over 3 weeks. So it's much more, doable, much more achievable for people who are, busy and they're working full-time jobs and have to work this into their job because they do have less time because everyone is back to normality.
So prior to doing compiling our presentation, we did survey past attendees. So we got some good feedback. 100% of those surveyed said they'd gained new knowledge or strategies from attending the course. So you can't get a better result than that. 86% said they'd implemented strategies that they'd learned in the course into their work. Again, that's a great result. And then 54% used between 1 and 3 new strategies, and 46% used between 4 and 5 new strategies. So that's nearly 100%. It just shows that everybody got something out of that course, whether they were working with someone who's deafblind at the time or not.
And what's a strategy, you ask? You know, what are the strategies we were talking about? We cannot say hand under hand enough in this course that we can just keep repeating ourselves, because everywhere we work, we see people that are taking people's hands, and we are very much against that. So hand under hand, clear beginning, middle, and end, all the kind of name symbols, you know, lots of different things. So really exciting to see that, you know, half used at least 3 and half used more than that, which was great. We also found, as I alluded to before, that 93% of the people who attended the course implemented the strategies with people in their service who are not diagnosed as deafblind or have any hearing or vision impairment. So found that very interesting, that they really spread the strategies around, and that everyone changed their view of deafblindness. So if we're going to work towards you know, recognition, building this this thought process, and you know, giving these ideas to people that you know, that people who are deafblind, you know, they're here in our country and they're with us, and having their service providers change their view, that's, you know, that's only going to help. So it was really nice to hear that.
So we did only get a 4.5 on our presenting, so I don't know what we have to do to get the 0.5 up.
Keeps you working harder, right?
Exactly. And we won't read out all the quotes here, they are quite lengthy, but I think the one that we enjoy the most on this is, this person commented, it's the quote at the bottom, that they'd never considered pupils who wear glasses and hearing aids as coming under the umbrella of deafblind. So it is just showing how broad the term is, and getting people rethinking about what their concept of what deafblindness actually is.
It's amazing how many people in working in disability services think that hearing aids give you perfect hearing and glasses give you perfect vision, and that everyone who wears them 24/7. It's amazing. So we really, the awareness piece in this course is that they have to understand hearing aids are not a magic. They don't, you know, this person still needs other strategies. So that was really, that was a really nice quote to get from someone, because there are a lot of students out there, even with Down syndrome, who wear hearing aids and glasses, who can benefit from the strategies that we're giving.
On this image, or on this slide, sorry, we have an image of a wooden statue with the question mark coming out of its head, because we still have questions. We're still evaluating ourselves, and maybe you have some of the answers for us today. Probably the biggest one we think about is, should we separate out the diverse needs of deafblind people? So should we have courses just for people who work with adults versus people who work with children? And as we mentioned, our course is free, and that's because we want as many people as possible to attend. But should we start charging a fee for it? I don't know. And then we've been asked before if we can record the training and send it out. But we're a bit hesitant about that, because it really takes away, you know, the interactive piece, which is difficult enough as it is online. Yeah. But, you know, it's just taking away that personability, I suppose, within it. And
I'm as guilty as anyone. If you get a video or you say, you know, oh, I missed that webinar, I'm going to go watch it. You're eating your lunch, you're checking your email, you're yelling at the kids, you're checking the laundry, you know, you're distracted. And you don't fully watch those videos. I hate to say it. And I have a few people nodding. We really like the live the live is where you give that energy and where you share those strategies and really kind of, you can answer people's questions on the spot. And so we're not opposed, I should say, we may record them at some stage, and we've done some small short snippet recordings for the staff as part of their training when they join the Anne Sullivan Center. So we might just take one strategy and just record that. So it's like 5 minutes, and it's really easy for them to work into their day. But to record a 1 hour, we're just hesitant. But we'd be interested in hearing if anyone has done this or not done this and what your thoughts are. And then the last one is, we do have guest speakers and involve members of the deafblind community and come and talk about their lived experience as part of the course too. So that's something we'd like to grow even more and give them more of maybe the onus and allow them more kind of advocacy for themselves and to participate more in the course. So that's something. I think that's it. We got to the last slide, and we do have time if anyone has not just questions, but if you have comments or ideas for us or thoughts. If there's anyone here from a country who doesn't have deafblindness recognized, please make yourself known, because we would love to join forces with you and maybe create some type of consortium and work together to try this. But I think in the meantime, we just plug along and keep going. So any questions? The mic is here, and just raise your hand.
All right. First of all, I want to thank you, Deirdre and Circa, for your presentation. It was very interesting. I think with this in the new world, the post-COVID world, when more and more stuff moves online, I think history will look back as the two of you as pioneers in this, because everything seems to be moving that way. And secondly, I've been in the field now this is my 35th year, which is remarkable because I'm only 40. But I think sometimes in some of the more countries like Canada and perhaps the US, we forget we have so much of an advantage now that we forget where we were 35 years ago when we were fighting the same struggle as these two women are fighting in Ireland. It boggles my mind that you don't even have it recognized. So my heart goes out to you for that, but I think it's important that we remember we were probably all there 30 years ago, and we're still sort of deafblind as a disability is still the best kept secret. So I can't imagine going back to the grassroots level. I can answer, instead of asking a question, I can answer one for you. Do you want to charge for the course? Yes. That can be answered.
That's what our organization would like to hear, but we haven't done it yet.
And then secondly, if you're looking for a geographical context, Ireland could probably fit in Ontario 3 times. So it's about the size of PEI, I would say.
Okay, PEI, there we go. Is that
But
better?
anyways, I will open it up to the floor to questions, and I think we had over here first, right?
Melanie speaking. You may have mentioned it, I might have missed it. How many people would you have online at once in your course?
It could vary. Well, how many sign up or how many show up?
Both.
We've recently had maybe 30 people sign up and maybe 15 show up.
Yep.
We've done the course to 2 people, I think, up to 60.
Yep.
60 is the highest.
Yep.
60 was
online at once.
Yeah.
Oh wow.
Yeah.
Yep.
Yeah, but that was once.
Yep.
And I think that was the time that our social media person, media person, put the course up on our social media. And that's when we got people from different countries, which was fine, but it was like all of a sudden, I said, where are these people coming from? Because normally we just send out the flyer to local organizations, and then all of a sudden there was people. That's why the map is there. So anywhere from 6 to 60, but usually around 20, 25. Yeah. And we run it, we didn't say this, but like this year we did January, March, June, we did the course. And we'll do another one in September and probably another one before Christmas. So that's what gives the numbers per year. Susan.
Hi, it's Sue. You mentioned you showed us the results of the survey where you asked your past participants if they had applied different strategies. how many of those past participants are you seeing in your travels? And are you actually seeing evidence of them using the strategies, or did they self-report incorrectly?
That's a good question. I think it's an anonymous. They don't have to put their name on it, so we don't have a way to check that. But just anecdotally, I have noticed things when I go into schools, particularly, that people are doing things. They're like, oh yeah, we have, because before we'd find calendar systems in, that locked cabinet over there that no one can reach, and now they're out, and different things that you're seeing, that they see the importance of it.
So you've got that confirmation then.
Yeah, I think so, in little bits and pieces. I'd like to say it's because of us, but really don't know. We really don't know. But I think the main thing with that example is we really reiterate that whether it's pictures, objects, sign, whatever the person is using, it's their language, and they need to have access to it. And that's something people don't think about. They have kids in the class with autism who rip everything apart. Oh, so we have to put it away. So it's safe. And that, I said, well, did you come to work with your mouth and your hands? Did anyone tie up your mouth so you can't talk at work? Things like, we don't usually say that, but that's really what it's like. Sorry.
Hi, this is Gloria from Perkins School for the Blind. We work in Latin America with different parts of the world, but have you thought, but we do a lot of training online, so it's very interesting, and I really resonate with a lot of the information you gave us. But talking about expanding, and I understand deafblindness is not recognized in your country, and that happens in a lot of countries in Latin America and around the world. But have you tried to go to the governments and tell them what you're doing? Are you connecting with the governments so they know that you're doing this, that your foundation is doing this around Ireland? I think it's a way to starting recognizing deafblindness if they know what you're doing. I guess you're doing it, but I wanted to make sure.
Yeah, they ignore us. They cancel our meetings. We went before, the Oireachtas committee would be like, what would you compare it to here? It's an Irish word, so Parliament meeting in 2015, and it was the, for children and, what was it? The disabilities in children, and one of the women in our advocacy group who has Usher syndrome went and spoke before them and talked about all of the needs and everything, and they were like, yeah, but they haven't done anything since. And we set up meetings with local councillors, and they canceled them, and there's other important things apparently. But we keep going. We just keep going. We're going to keep setting up a new meeting and keep going.
I just want to add to that. Keep trying, because I think what you need to find is that one person who's going to receive your message and then become a champion for you guys.
Yeah. And that's what we keep trying to find.
Completely agree with her. Find the champion.
Find a champion.
There's always someone. Someone, but you have to find it. And that will help you to go beyond.
We're hoping to come back from this conference and say, we look ridiculous. Like all of these countries that went to this conference have deafblindness recognized. Said, we are a laughing stock. That's what we're going to go back and say. We're a laughing stock. And we're going to say, look, there's all of these countries. We're in the minority of people that are of countries that are recognized. So it's all about money. I mean, you all know. It's about taking money from budgets and directing it towards a certain group. And they say they don't do that. But of course they do. Hello.
Kia ora. My name's Amanda, Deafblind Association New Zealand.
Hi.
We don't have deafblindness recognised as a distinct disability either.
Okay.
What we do have in our favour, and we intend to tap into very soon, is that New Zealand has just formulated a ministry for disabled people. Woohoo! So we have people on our side, which is fantastic.
Okay.
So we will take deafblind forward for that. So there is hope there. But I also just wanted to say about whether you record your learning or whether you deliver in person. As a deafblind person myself, the closer I can get to somebody's energy, the easier it is for me to learn.
That's great feedback.
Yeah.
Thank you.
As closer as I can get to you, even if it's down the screen.
That's fantastic
You're
feedback.
Still a live person. Kia ora.
And we have had individuals who are deafblind join the course through why am I the typing? Oh my goodness, what's the word? Captioning, but there's another word for it. Anyways, and through ISL interpreting and all of that. So, we've had to adapt and it's been great because even the other participants that join and see the ISL interpretation, that see, what is the word I'm looking for? PCR, what do they do? Yeah, see, we can't think of it. Anyways, the people who come and type the captions. There's another word. It's embarrassing. It's another word.
I can't remember.
Can't think of the word. It's an Irish word, so nobody knows it. That's fine. Where we go. That people seeing those accommodations and adaptations, and that we just carry on and go, and it doesn't matter. It's very educational for them too, because they're in the course with them for the few weeks or whatever. So that's been eye-opening. Yeah.
Hi. Hello.
Graciela.
I'm Graciela Ferioli from Argentina. And I want to congratulate to both of you, Deidre and Sorcha, because there are so many places in the world, and particularly I know about Latin America, that we don't have services at all. So the kind of work that you are doing really is like Sue said, keep going. Keep going.
Thanks, Graciela. Thank you.
We need
that means a lot.
But the second comment that I would like to share with you is some challenges that I find by myself when I teach online is to make the balance between the practice and the theory.
Yes.
And sometimes you cannot see how that practice, how that theory is applied into practice.
Yeah.
Something that I was using in the past months was to ask the people to make some video clip. So you develop the class, the model, and you ask them, okay, for homework, like you have,
Yeah.
you ask them, okay, make a video clip with your client or with your child and try to show how you do. And some people like to show. Some
Yeah.
people, no. But that's okay. Well,
That's a great
it's
idea.
suggestion. I don't.
That's a great idea. Thank you. We're always looking to add and change how we present, so I appreciate it.
Okay, that's all the time we have. I want to thank Deirdre and Sorka again. We do have a little parting gift for you, but I just want to reiterate again, we're talking 2 ladies. I think you said there was another half position involved
half a person.
for an
She's like,
entire
"Keep it
country. So we have to think, I think, globally how we support these ladies and some of the other we had examples of Latin America countries who just don't have the services we do in some other countries. We have to support each other, because if the wheels of justice move slow, the wheels of politics move even slower. So I understand the fight you're up. But thank you again.
Thank you.
And we have a little something for you, and it's about, I guess the next session is in Canada 1, so make your way up there and enjoy the rest of your morning.